Hello and welcome to episode 22 of season 6 of the Fat Doctor podcast. I am your host, Dr. Asha Lamy, and today we're going to be talking about a lady named Priya. I made her up, just like I made up the last two people we've been talking about, but she's very real in my mind. I can see her in my mind's eye. Um, and we're going to be talking about her experience, why she's struggling to get the healthcare that she is entitled to, that she deserves, just basic healthcare, not anything extraordinary, not not like worthy of the pit healthcare. Yeah, nothing like that. Just regular healthcare, standard, normal healthcare. Um, I love the pit. Oh God, it's my weakness, and I really shouldn't. I never ever watch medical dramas because they usually piss me off. And there are many things that I have to say about the pit and how problematic it is, and just like that. By the way, there's no such thing as an emergency department that is filled to overflowing with really nice doctors who really care about their patients and will go the extra mile. That doesn't exist in real life. But like I said, I'm not talking about the pit level healthcare. I'm talking about standard, basic, like, here's the bar. You just need to, like, step over it, you know? We're not pole vaulting here. We're just stepping over the bar. And Priya's not even getting that. And so let's talk about it, shall we? Let's get straight into it. I'm running out of steam because this is the third podcast I've recorded in a row. So Priya is in her late 30s. She is self-employed. She's artistic and very cool. She wears cool clothes, and she's one of those people who can, like, draw stuff. Like, when you want to be on her team in Pictionary because, like, she can just draw and everything she does is beautiful, and you admire her and slightly envy her. And she has, like, really long, beautiful hair. Um, she has spent her whole entire life putting everyone else first. She's one of those people. You want to hate her, but you can't because she's really kind. And as a result of putting everyone else's needs first, Priya's always a little bit tired. She works too hard, and you know this about her. She's one of those. But for the last 18 months, she has been experiencing a level of fatigue that she's never had before. It's been building slowly. It's not dramatic. She's just noticing she is more and more and more drained. She's had blood tests twice. Both times they've come back normal. Her doctor said everything's fine, nothing to worry about. Off you go. Get more rest, you know? Try mindfulness or whatever it is that doctors do when they're just like, I don't know what's wrong with you and I need to get you out of my chair. So, try a mindfulness app, or something equally as unhelpful. And you know what? I'm always ragging on doctors, but there are times when we really just don't know. We don't know. And you're looking to us for answers, and we're thinking, fuck, I don't know. By the way, I feel like you. I'm also drained. I'm also exhausted. I'm also not getting enough sleep. So it's difficult sometimes. I don't want to constantly make it about how shit doctors are. Sometimes we really don't know. So she's been fobbed off because her blood tests have been normal. But that's not helping, is it? Priya's still in a bit of a pickle. She is now cancelling commitments. She's saying no to things that she used to love. She's putting things off. She's a bit more forgetful, and she's putting it all down to burnout, which is understandable because she's late 30s and she's a giver, and she's somebody who's always helping other people. So of course she's burning out. Makes perfect sense. Something's telling her, like, oh, but what if it's something else? Like, she's got this niggly feeling, right? She's talked herself out of trusting her own instincts because her doctors have said everything's normal. So, okay, the doctor said everything's normal, everything must be normal. What the doctor should have said is your blood tests are normal. The blood tests that we ordered, that we thought to order, have come back normal. That's not the same as saying everything is normal. It's clearly not normal. If it was normal, she wouldn't be feeling this level of fatigue for the last 18 months. But when somebody in a position of authority and who has blood tests in front of you can go, no, everything's fine, you learn to trust them over your own instincts. You learn to trust their ruling over your own experience, which is a real shame. That's why language matters, right? If you say to someone, the blood tests that we ordered are coming back normal, that is a very different vibe to everything's fine, everything's normal. Very different vibe. So, you know, obviously, Priya's fat because otherwise I wouldn't be talking about her. The day I do a thin patient is the day we know that something's gone wrong. So Priya's fat, and she's South Asian, and so doctors make a lot of assumptions about her. Um, I don't need to tell you what they are. You already know what they are. You already know that they're problematic. And so one of the things that she's often told is she needs to exercise more. You're feeling tired, exercise more, move more, go out, have a walk, you know? I mean, they've never asked her whether she does exercise in the first place, whether she does go for a daily walk. We don't, there's no point in asking. We'll assume you don't and tell you to go out and exercise more. But she's actually very, very active, or she has been certainly very active. The fact that she isn't active anymore is actually a sign that something's wrong. She's exhausted, not inactive. So this kind of like just exercise more is actually quite devastating. It's really like it's like A, you're missing the point, and B, you're kind of like rubbing salt in the wound. I'd love to be more active, thanks. I just don't have the energy for it. Also, and she's really not happy about this, she's developed like spots, a rash on her face, like here and here, and it's like a little bit red, not red, like darker, on her skin. She looks like she's a teenager with acne, which is no fun when when you're in your late 30s. And her beautiful long hair that everyone admires is starting to thin in places, especially at the back and around the front. So these are all things that she's feeling really ashamed of. And obviously they're not important. They're just, it's vanity, isn't it? Who cares? But that and the fatigue and the burnout and like cancelling plans, it's all starting to pile up on top of her and it's affecting her mood. This isn't like her. It's really not like her. Now, one day, she stumbles across a video, a reel on Instagram or YouTube Shorts. I haven't decided. I'm not sure which one I like more. Not on TikTok. Priya wouldn't be on TikTok. She has too much self-respect. But she comes across a video. We'll put it on YouTube Shorts actually. All right, she's on YouTube doing something sensible, and then she happens upon this video, and it's a video all about PCOS, and it's somebody in the PCOS community that's talking about their symptoms and starts listing them off, and Priya's like, "Whoa, hang on a second, I can tick literally every single one of those. What is going on here?" She's always had irregular periods. She's mentioned her irregular periods, but she's had irregular periods since she was a teenager. She was always fobbed off. Oh, well, when you try to get pregnant, if you've got any issues, then come back and see us. Like that was, she's a woman. Her job in life is to procreate, to reproduce, to have children. So, at that point in time, we'll deal with it. But other than that, who gives a fuck? Periods? We don't care about periods. That was sarcasm for those of you who couldn't read that. We should be caring about periods. The fact that we don't care about periods is because of medical misogyny, and it's very problematic. But yeah, nobody seemed to care before, and she's had blood tests twice. Why haven't they picked up on it? What why hasn't her doctor done something about this? This is clearly this is her, right? The reason they haven't picked up on it is because they didn't think to ask. They didn't do a blood test. I mean, they certainly didn't include that in the blood test. Although, to be fair, you don't need to do a blood test to diagnose PCOS. You can diagnose PCOS based solely on her symptoms. I, as a doctor, can make a diagnosis of PCOS through this podcast for my imaginary fake character. She meets all the diagnostic criteria. I should say that the name for PCOS has just changed, and I forgot what it's called. We're going to call it PCOS for now, but it has changed. The diagnostic name, the official name. It's supposed to be better. It's basically sort of telling people this isn't about your ovaries, right? Like yes, of course your ovaries are involved, but this is an endocrine condition. This is a hormonal imbalance thing. It's about much more. It's metabolic. It's about much more than just your ovaries. It's basically about much more than whether or not you can reproduce, because that's all we cared about once upon a time. But anyway, yeah, she meets the criteria for PCOS. She certainly wouldn't have had a blood test because that's an extra test that a GP wouldn't have just requested for no reason. And they've clearly not asked her about it. They've clearly not put two and two together. Maybe Priya's not felt able to answer all the questions, but they're going, she's going to see the GP about this rash, which is acne. She's maybe she's mentioned the hair thinning, maybe she hasn't. The doctor certainly knows about irregular periods. That's a code on the computer right there for them to see. And she's talking about fatigue. Yeah, you put all of these things together, diagnosis is fairly obvious. She's in her late 30s, so perimenopause is less likely, possible but less likely, because this would actually be premature ovarian failure if you're under the age of 40. However, doctors should be thinking hormones, and they very rarely do. So why? Let's say it all together. Ready? On the count of three. 1, 2, 3. Medical misogyny. That's right. The thing about normal bloods, no, normal in inverted commas, is that it's only the blood tests that we request that come back normal, right? I made a point already about that. If we don't ask, if we don't look, then we don't know. Now, I'm not saying that doctors should request every single blood test on the planet for every single patient. That's not particularly helpful. You know they're going to test you for diabetes because you're fat, especially if you're fat and South Asian. So they'll have done that. And they will have done a full blood count, certainly, because who doesn't do a full blood count? They probably tested your kidney and your liver because that goes without saying. They might have tested your thyroid, but they might not have. So that's important. Was the thyroid function tested? Because that could be it. Less likely in the first instance to test iron, B12, or vitamin D. Vitamin D is controversial. The iron and B12, they probably only test for if you're anemic. Now, that depends on where you are. If you're in the States, they've probably tested for everything because money. But if you're in the UK, they've probably tested for a lot less because money, but the other way around. So we're trying to save money, so we don't do tests that are unnecessary. Either way, you can't guarantee that they will have done all of these things. It's possible that you're not anemic, but you still have a low iron or a low B12, and that might explain the symptoms. With your thyroid, it's possible that you're in the early stages of thyroid dysfunction, and so maybe your thyroid level is normal, but your TSH is abnormal. It's tricky. I don't want to get into the nitty-gritty details, but it's worth thinking about all of these things. But there are loads of other reasons, conditions that often get missed that doctors don't think about, and they just blame on your weight. I said hormones, menopause, PCOS, really important. If you have XY chromosomes, if you are a male, then it could be low testosterone, very common. Again, we'll get blamed on your weight, but it's more common than we think. Fibromyalgia, hypermobile EDS, long COVID. These are all things that we need to consider. ME or chronic fatigue syndrome, another one. Those ones are more diagnoses of exclusion. So once we've ruled out the other bits that, because there's no test to rule those things in. Sleep apnea is a very obvious one. Now, again, if you're fat, doctors will often think of sleep apnea. It's usually, unfortunately, the thin people that don't get the sleep apnea diagnosis, but not all doctors will think sleep apnea. If you're waking up every morning, either with a headache or you just don't feel like you've got a decent night's sleep, even though you actually did sleep for 8 hours, then you need to be tested for sleep apnea, because it's much more common than we think it is. It could be related to your mood. It could be born burnout. Priya, like many of us, could be a late or somebody who was autistic and has always been autistic but was never diagnosed. And the fact that she's always helping people and she's always trying to be kind and is always putting other people's needs before her own could just be because she's masking. And actually, this is autistic burnout. It's possible. Ask me how I know. So a good doctor sees that Priya is fatigued. Priya's come in and said, I'm fatigued. It's been going on for 18 months. A, believes her. B, doesn't make any assumptions about why this is happening. And C, gets curious. Oh, you're fatigued. All right. Tell me more. And asks very open-ended questions. Tell me more. What's going on? Listens actively. Maybe make some notes. I like to make notes because, my mind's not always as sharp as it needs to be, especially if it's my 15th patient of the morning. Maybe make some notes. So it's okay if they're typing away, making some notes. Yeah, just so that they've got that fresh in their mind, but still paying attention, still listening, not like ignoring. Maybe ask some insightful questions. Oh, hang on a minute. So, you mentioned about your periods. Tell me a bit more about your periods. Yeah, that kind of thing. Um, Asks anything else? Which, if you haven't got that much time, if you've only got 10 minutes to see a patient, asking anything else is a very risky, it's a risky business. It is potentially very dangerous. You are opening up an entire can of worms, potentially. But unless you ask, you won't know. Sometimes people don't offer up important information unless you give them that opportunity. So ideally, ask anything else. They take a history and they go, oh, right, okay. Now, with fatigue, there's probably not an examination that needs to be done. Like if the patient mentions something specific, like, oh, and also I'm losing my hair, you might go, oh, let's have a look. Show me. But if, oh, this rash, let's have a look at the rash. But if there's nothing specific, an examination is not warranted. Like pain warrants an examination, shortness of breath warrants an examination. Sometimes a blood pressure, listening to the heart and lungs, depends, right? I'm not going to tell you exactly what a doctor should be doing because it depends on the individual. But we've done blood tests already. There might be some more blood tests. Think, oh, do you know what? We didn't do these ones. Maybe we ought to do these ones. But if blood tests aren't warranted, there might be other things that we can do. So if I thought it was perimenopause, for example, I might give them a green questionnaire and ask them to fill it in, or as I said, it's probably not perimenopause in this case, but if I think it's PCOS, we might be start chatting about that. There'll come a point in time in the consultation where I've done the history, the examination that's warranted, requested any blood tests if they're warranted, and then I got to think, okay, what do I think is going on and what's next? And a good doctor is really honest and says, I don't actually know what's going on, or I can't say for sure what's going on, or it's not very obvious, or it's not very clear. There's no clear diagnosis here. It could be, and we might list some things it could be. Um, do you have any idea what you think it is? Or is there anything that you're concerned about? Like, that's another question that we could be doing at this point in time. But we have to be honest about what we do know and what we don't know. So here's what I think we should do. We're going to order some tests. We're going to refer you to a specialist. We're going to look into something more. We're going to follow up in 3 weeks' time. We're going to try a treatment. Like, there is a number of options now, depending very much on what the doctor thinks is going on. But what we do is we offer it out. The good doctor offers it up and says, what do you think? Which one appeals? What's your instinct? Which one would you like to try? Because a good doctor knows that patients have autonomy. They have the right to decide what happens to their own body and to their healthcare. They need information from their doctors, information that only doctors can provide. That's why we're here in the first place, why doctors go to medical school and do all of that training, so that they can offer up the information. And then the patient gets to decide what to do next. That's what a good doctor should do. That's what should happen. That is, and by the way, again, basic care. It's not heroics. This is not wishful thinking, pie in the sky. This is what you learn day one when you're learning how to be a doctor. Doctoring 101. This is the first thing they teach you, like listen and autonomy and all that shit. Like this is not new information. No doctor can claim this is brand new information. This is just what we should be doing. And as I said, 10 minutes isn't an awful long time. Bearing in mind that after the patient leaves, the doctor has to write up the notes and then see the next patient. If they've requested blood test, they've got to do that then and there. If they've done a prescription, they've got to write the prescription, make sure the prescription is correct, haven't made any mistakes, sign the prescription, send the prescription off. There are lots of things a doctor has to do in that 10 minutes. 10 minutes is never enough. It's shit system, really shit system. And going back to my favourite programme, The Pit, there is a moment in time where in the second season, no spoilers, I don't want to spoil too much, but basically the two senior doctors are having a conversation and one senior doctor is talking about AI in medicine, which is a very controversial subject that one day I might do a podcast about. And, should we use it? Shouldn't we use it? And the other senior doctor makes a really good point. The moment you use AI, it might cut down on the doctor's time. It might improve their efficiency, but all that means is they're going to shove more patients on us. It's not like they're going to go, oh, cool, take a break. And that is the problem. There, there's no. The only way to improve the system is for the people at the top to decide to prioritize patients over profit. I don't see that happening anytime soon. So we got to live with we've got, right? And that's why it's helpful to have very specific language. That's why it's helpful to have community. That's why it's helpful to have an advocate. That's how why it's helpful to join the No Way movement and get yourself a free script so you can use Asha's language. And for some of you, that's why it's helpful to book a consultation with me, a one-to-one for 90 minutes, not 10, 90. And I do 90 because it takes 90, and usually it takes longer. And that might feel like a really long time, but it's not. It goes really, really quickly. So it might be that you that you need to book a consultation with me, and that's the solution. But the most important thing is that you have the information. And again, I cannot stress this enough. You shouldn't have to become an expert in your own symptoms to get decent care. It's not fair that this is happening. I will, this is, it's totally unfair and totally unreasonable. And also, sometimes it's the only way for you to get decent care. And that sucks. I often say I shouldn't exist. Like I kind of like that is my aim in life is for the conversation to move forward and for things to change so dramatically that people just no longer need me. And that is that then I will be able to say, my job is done, or whatever it is that Thanos says, like I'll be able to sit in the sunset and look over a grateful universe or something like that. I don't know. I'm not Thanos and I'm not that vain or narcissistic, but still. I really would like to work myself out of a job, is what I like to do, because none of it's fair and none of this should happen. And if the system worked the way it's supposed to, and I'm not even asking for special measures, just for doctors to do the very thing they're supposed to do, the basics, then none of you would need this podcast because you'd be getting the medical care that you need. Just because your doctor says everything is fine doesn't mean that everything is fine. If you don't feel fine, then everything is not fine. All right? It's not about numbers. It's not about what the doctor has decided. You know your body better than anyone else, and you are the expert. And as I said, there is explicit language within a doctor's duty of care that says the patient is their own expert in their own body. All right? I'm paraphrasing, but it's explicit. It's not implied. So don't ever be don't allow anyone to make you feel like they know more about your body than you do. Nobody does. There is a very big difference between being managed and being heard. The good doctor listens. The bad doctor manages. You deserve a good doctor. When the system works well, Priya gets a diagnosis and is offered treatment. Treatment of PCOS. God, that's a whole different conversation. This is another podcast, but is offered the treatment that they deserve and is given the choice. That's when the system works. If you are interested in knowing what the system should be doing, how the system should be operating, I recommend my book, No Way. Everything you've been told about weight loss is a lie. It takes you through from the very beginning. Like the first chapter is all about the fact that there is no such thing as a healthy weight. It might sound very basic, but most people are under the impression that there is something pathologically wrong with their body just because they're fat. And that is a lie. The first lie that I chose to address, the first myth that I chose to dispel, that actually fatness is not a disease. It's just some bullshit made up by insurance companies and pharmaceutical industry and Weight Watchers. Like it's absolute crap. Fatness is not a disease, and I'm willing to stake my medical career on it. And then it takes you through from there. Tells you all about how weight loss isn't sustainable, and even if it were sustainable, being fat is not the reason that you're sick. And even if it was the reason that you're sick, actually trying to lose weight is going to make you more sick because it results in weight cycling, and weight cycling is bad for your health. In fact, dieting is bad for your health. So the cure, the so-called cure to the disease that is fatness, is actually the disease. Like it's the problem. It's the problem, not the solution. I talk about doctors and how doctors are making you sick because of their weight stigma. I show with a lot of evidence and leaving little room for doubt that weight loss has never been shown to improve your health in any way, shape, or form, to prevent conditions, to treat conditions, to extend your life expectancy, to put you into remission, all of that stuff, all the things they've lied to you and said it will do. Like really, it doesn't. There's no evidence that it does. But I spend the last three chapters of the book talking about why in spite of all this evidence, doctors treat you the way that they do. I talk about how corrupt the guidelines are, how corrupt the experts are. I talk about the pharmaceutical industry and how it has bought and paid for your current medical healthcare. How it the pharmaceutical industry, especially the manufacturers of GLP-1s, pay for the research, they pay for the guidelines, they pay for they educate the doctors, they buy politicians, they buy everything. Um, and I talk about just how problematic that is, just how harmful it is, just how infected society has become by the weight loss agenda. And the last chapter is called Know Your Enemy. And I really believe that knowing your enemy is well, I think Sun Tzu said it, but it's that's how you win a battle, right? It's how you win the war, is to know your enemy, not just to know yourself, but to know your enemy. And a lot of times we focus on what can you do to advocate for yourself, and that's really important. It really is. But also, it's about knowing your enemy and how to defeat them. So yeah, that's my book. Book a consultation with me if you want. Join the No Way movement. Consider joining our lovely little waiting room online community. We're a lovely bunch and we do so many fun things together. So if that appeals, we'd love to have you. And I'll be back next week with another character. And until then, you take care of yourself. And yeah, I never know how to end these things. In the meantime, take care of yourself.